Everybody, I am Naufal. Welcome to my channel. Today we are going to discuss regarding BLS, that is Basic Life Support. So as per the American Heart Association AHA, certain guidelines are there. According to that, priority step by step only we have to give the basic life support. So the first step in the BLS as per the American Heart Association is scene safety. Verify the scene safety before giving the basic life support. You have to check whether the scene is safe or not. For example, if the patient is touching the electric wire, and if you go and touch the patient, you will get the electric shock. Chance is there. And if the patient is in the water, you don't know swimming. If you are going to give the basic life support, it will harm your life also. That means the scene is not safe. So first of all, you have to check the scene safety. If the scene is safe, you can move to the next step. If the scene is not safe, no need to give the basic life support because it will harm your life also. If the scene is safe, move to the next step, that is check the response of the patient. Check the response of the patient by tapping the shoulder forcefully. Tapping the shoulder forcefully like this. That time you have to call the patient, are you okay? You have to ask the patient, are you okay? Same time you have to tap the shoulder forcefully. Check the response. If there is no response, you have to call for help. If there is no response, you have to call for the help. Call someone near to you for help and ask them to activate the emergency response system. Call for the help, ask them to activate the emergency response system. That means ask them to call the ambulance and ask them to get me an AED. Ask them to bring a AED, that is automated external defibrillator. It is a defibrillator that is seen in the shopping mall or in the airport or in the bus stand, like that public places we can see that defibrillator. It is a automatic defibrillator that is different from the defibrillator from the hospital. This is a automatic defibrillator. So ask them to bring the AED also. Now afterwards, the next step is check the pulse. Check the pulse. So while checking the pulse, for adult you have to check the carotid pulse. For adult you have to check the carotid pulse. If it is a children also, you have to check the carotid pulse. But if it is infant, check the brachial pulse. Check the brachial pulse for the infant and check the carotid pulse for adult as well as children. It is a question for your exam. While checking the pulse, same time you have to check the respiration also. While checking the pulse, same time you have to check the respiration. How you have to check means check the chest rise of the patient. While checking the pulse with your eyes, you can check the chest rise of the patient. So pulse and respiration together you have to check, and the maximum time to check the pulse is 10 seconds. Within 10 seconds you have to complete the procedure of checking the pulse and respiration. Now if there is no pulse and no respiration, if there is no pulse and no respiration, you can move to give CPR. CPR means cardiopulmonary resuscitation. You can give CPR if there is no pulse and no respiration. You can give CPR, that is cardiopulmonary resuscitation. While giving the CPR for adult, the compression rate is 30:2. This is important for your exam. 30:2. 30 compression you can give. 30 compression you can give and 2 ventilation, airway, 2 breathing. 30 compression you have to give and 2 ventilation, that is airway, breathing you have to give 2. The ratio is after 30 compression, 2 ventilation for adult. If it is a infant, only one rescuer is there. Single rescuer is there. Only one person is there. So, the compression ratio is 30:2 for infant. If two rescuer, two nurses are there, two person is there. So, the compression ventilation ratio is 15:2 if it is a infant. Very important for your exam. Adult 30:2, for the infant one rescuer, only one person 30:2, two rescuer is there, 15:2 is the compression ratio for the infant. Now the exact point where you have to give the compression is the center part between two nipples. The center part between two nipples. Between the two nipples, the center part is the place where you have to give the chest compression. You have to give the compression by locking the hand. Like this you have to lock the hand. And this part you have to give the compression. This part you have to touch the mid part of the nipple. You have to touch and you have to give the compression. 30:2 is the ratio for adult, 30:2 for one rescuer in infant, and if two rescuer is there in infant, 15:2 is the ratio. Now while giving the compression rate per minute, how many compression you have to give? As per the AHA guideline, it is 100 to 120 compression you have to give. 100 to 120 compression you have to give. That is a question for your exam. Now regarding the depth of the compression. If it is an adult, at least 5 centimeter. At least 5 centimeter depth you have to give the compression. If it is a children, approximately 5 centimeter. If it is adult, at least 5 centimeter compression depth you have to give, and if it is a children, approximately 5 centimeter depth compression you have to give. If it is an infant, approximately 4 centimeter compression you have to give. It is also a question for you. For infant, 4 centimeter depth you have to give the compression. If it is an adult, 5 centimeter at least. That is important. At least 5 centimeter for adult, and for the children, approximately 5 centimeter. And the compression rate is also important. 100 to 120 compression you have to give in a minute. In a minute, 100 to 120 compression you have to give. Now, this time, the person who went to take the AED, he will bring the AED, that is automated external defibrillator. So, it is automatic. So, first of all, what you have to do, open it and connect the pads. Connect the pads of the defibrillator. 2 pads will be there, and the instruction will be already given in that pad where you have to place the pad. So, while placing the pad, keep it in mind, one pad you have to place at the chest, right side upper right side, one you have to place, and in the chest lower left side, the next pad you have to place. Now you can switch on the AED. Now you will getting the instruction from the AED. Automatically the AED will check the rhythm, whether it is a shockable rhythm or non-shockable rhythm. If it is a shockable rhythm, press the shock button, give one shock. While giving the shock, don't touch the patient. If it is a non-shockable rhythm, you can continue the CPR. If it is a shockable rhythm, give the shock, then you can continue again the CPR. Now continue the procedure until the ACLS team arrives. Continue the procedure until the ambulance arrives. That's all regarding basic life support. We will meet soon with another video. Till that time, thank you and goodbye.